question which I have given private notice. The question is as follows: to ask His Majesty's Government what assessment they have made of the effects of upcoming industrial action in the NHS.
My Lords, strikes are disruptive and costly. The strikes in July cost around £240 million. Thanks to the heroic efforts of other NHS staff, during the recent November strikes, the NHS was able to maintain 95% of planned care while still maintaining critical services. I urge the BMA to reconsider their plans for more damaging strikes before Christmas and to work with the government to improve the working lives of resident doctors and to rebuild the NHS in partnership.
My Lords, can I thank the noble lady, the Minister, for that answer, but also pay tribute to those hard-working doctors who kept going despite the feeling for industrial action by many in the BMA. My Lords, the timing of the BMA's announcements is surely no coincidence. Is it not the case that last week's budget would display the Chancellor's readiness to increase the burden on taxpayers in order to fund public spending, will have sent a clear signal to the BMA that there is scope for them to squeeze even more money out of the Treasury than they did last year with a 29% pay rise that they were awarded? So will the Minister take this opportunity, and noble lady Minister, take this opportunity to confirm the government's position? Do they agree that a further massive pay rise for resident doctors at this time is completely unaffordable?
Quite frankly, I don't think any Secretary of State could have been clearer in his repeated words that he cannot increase the pay of resident doctors. They have received an average 28.9% pay rise compared to 3 years ago, the highest settlement in the public sector. He has the door open to discuss conditions, to deal with the bureaucracy that they face and to improve the conditions for the resident doctors. But absolutely, I don't think the Secretary of State could have been any stronger than he has been about his intentions in this.
That has the government learnt a lesson that to give the resident doctors a nearly 30% increase in future when pay increases come, it should be linked to reform, not just a blank cheque?
Well, the reform has been agenda, plan for change, has been very clear from the outset of this government, and it's been a very clear recognition that things do need to change. That has been absolutely driven the efforts to do everything possible to improve conditions for the workforce, but also for those in receipt of care. It has not been good enough. We have a huge job to do to improve the NHS, to make it fit for purpose and to continue to deliver excellent care for people up and down the country.
The fundamental issue here that many previously professional organisations now seem intent on acting not as trade unions but as parodies of trade unions of the 1950s. And underlying that, is there not the appallingly low turnouts in the election for executives, normally in single figures? What are ministers in this department and others doing to try and win the battle for hearts and minds to increase turnout to get more representative leadership?
Yes, I agree. It's absolutely essential that we move forward to modernise industrial relations, which is exactly what this government is doing. We know that strong trade unions are essential for tackling insecurity, inequality, discrimination, enforcement and low pay. But we have to move forward to a situation where there's more communication and negotiation and space for collaboration in order to deliver our objectives and to take people with us.
My Lords, during the doctor strike of 2023, I was left to die with untreated gallstones and sepsis in an NHS hospital. The only thing they offered me during that time was do not resuscitate. I am only here today, my Lords, because my friends and family managed to get me transferred to a private hospital for emergency surgery just in time, and I thank them, all of them, for everything they did. But I know, sadly, my Lords, that many others would not be able to do that. So, my Lords, when will enough be enough? And what will the government do to ensure that doctors fulfil their duty to patients? They exist only to do that and to serve.
Well, can I start by saying I'm very sorry to hear of the noble lady's unfortunate experience, and I'm very pleased to see that she is here back on the benches fighting her corner. But this is absolutely the backbone of what this government intends to do. We knew when we came into government that standards had slipped. The pressures on medical staff have been enormous, and it is our job to transform the service, and that is what we have put in place to do.
Listened very carefully to the excellent question from the noble Lord Speller, but I was astounded by the noble lady, the Minister's answer. I think I heard her correctly. She talks about modernising trade union regime. In the Employment Rights Bill, the government's actually going to make it easier and less difficult for trade unions to call strikes on lower turnouts. That's going to make the situation worse, not better.
Well, we beg to differ completely with the noble lord. We believe our Employment Rights Bill is the way forward and is going to improve industrial relations and make sure that we have workplaces fit for purpose moving forward as we go through this century.
Noble friend, tell us, what proportion of junior doctors are in fact taking action, and what are the consequences for the individual resident doctors, I should call them, resident doctors, on those occasions when they do take action? Because you hear stories of them, well, they've decided, the individuals decide they're going to take a long weekend, and in practice it's leave rather than anything else.
So I have actual figures in front of me for my noble friend. Data that we've received reported an average of 17,200 resident doctors absent from work in each of the November rounds, which was slightly higher than the 16.2 100,000 average in the last set of strikes in July. The resident doctors make up about 50% of the workforce of 1 million in the NHS in England. I think that gives a pretty clear sense. But of course, our sympathies go to all the other doctors and medical staff, all of staff in hospitals who have made the performance during those strikes so admirable. We will continue to support them and to make sure that they can deliver for the patients in their care.
My Lords, yesterday,
My Lords, I think it's the turn of the crossbenches.
My Lords, yesterday the Chief Secretary to the Treasury gave an interesting report, which was repeated here, and we had a 40-minute debate. The objectives of the Chancellor were 4, and one of them was actually to reduce waiting lists, not to increase anybody's pay, reduce waiting lists. Doctors going on strike are going to increase the waiting list. And what will the government do, knowing that the Chancellor cannot, under her physical rules, spend unbudgeted expenditure? Who will persuade the doctors that actually the owner a loose cause?
The noble lord is right that communication and talking is absolutely critical, and that is why the Secretary of State has on repeated occasions made it absolutely clear that the door is open to have those conversations, recognising the challenges that doctors have faced, whether it's bottlenecks in training, money being taken out by compulsory payments to joining Royal College of Physicians, and all of those things. But our absolute priority, as we have heard, is to reduce waiting lists, putting the patient at the centre of the NHS, and that is the mission that we're on, and we're determined to deliver it.
You will be aware, pay is only one part of what I understand the resident doctors are looking for. They are actually quite senior doctors. As I understand it, they're registrar and one step below consultants. They're often in their late 20s, early 30s. They're looking to form relationships, start a family, and put down roots. Yet they're only given security of tenure of something like 6 months, 10 months in each posting. And I don't believe that that's acceptable to give them a sense of permanency and value. This is something that the government really needs to look at as a matter of urgency. Will they?
The noble lady and I have discussed this in another forum in this House, and it's absolutely critical that we work with those doctors to find out exactly what their priorities and how we can work with them to give them more security, to make sure that the training posts are available. I'm pleased to say that on offer is consultation around all of these points. So we have to move forward. The door is open. We want to discuss how we can make improvements to the contracts going forward.
Well, it obviously goes without saying that the industrial action just before Christmas is completely unacceptable. But I'd be remiss not to observe that at the time that the 28.9% pay award was made, the Health Secretary did attribute problems in terms of industrial relations with resident doctors to the former government rather than an ongoing problem, and that's a matter of record. But can I ask the noble lady, the Minister, specifically, what estimate is the department making of the impact of other aspects of the NHS, particularly elective operations and primary care, of this completely unreasonable and uncalled for industrial action?
As I said earlier, we've done some analysis for the strikes that took place in July. We're working on the data for November, and we will obviously take the learning from that through to how we deal with the strikes going forward. But I just have to repeat, everyone in the health service has stepped up to the plate to make sure that the impact on patients is as low as possible. But we will not shy away from the fact that we think strikes in the run-up, the week running up to Christmas, is completely unacceptable. And I'm pleased to say that we've got the leadership in the Department of Health from the Secretary of State who has made his views on this exceptionally plain.
Isn't it the case that under the last government the health service was wrecked and the doctors' salaries were controlled to such a level that they fell behind previous years? Isn't the fact that we've made a substantial increase in pay, should that not mean that the doctors think that we are committed to the NHS and they should help us to deliver our aims and objectives?
Well, I think my noble friend puts his finger right on it. The facts speak for themselves, and I make no apology for repeating the fact that the resident doctors have had the highest pay award of the entire public sector this year, an average of 28.9% compared to 3 years ago. I believe that is an enormous commitment and a recognition to the work they've done and the fact that their situation had slipped behind. And we call upon them now to get round the table and work out, recognising that there is not more pay on the table at the moment, but there are other ways that we can work together to improve their conditions and make sure that we can all start delivering at full strength.
With the last question from the opposite benches, can I refer the noble lord to Radio 4 this morning? Because that makes it clear that since 2015 the junior doctors have had sufficient pay rises compared with other parts of the public sector. Whether that's fair or not is another matter. And could I ask the noble lady, the Minister, if she could tell the House how much has the government saved on pension contributions that we won't be making to pensions that will be foregone by the strike, and the same on employers' contributions for holiday pay? And obviously, if she doesn't have those figures to hand, if she could write to me and put a copy in the House library, please.
I think he's preempted, the noble lord has preempted my answer. I'm very happy to write to him to give him the details he's requested.
Minister, like everyone else, I think this strike is absolutely unacceptable. But instead of consultation, wouldn't it be possible for the government to organise with the NHS extra jobs, which is one of the problems which I gather the resident doctors are so concerned about?
Yeah. So the initial offer would have doubled the increase in the training places over 3 years. It was 1,000 new training places. The offer has since been up to 2,000. We recognise that there are shortfalls. We know that it's very patchy. We know that there are differences between departments. That's why we need to have those detailed consultations to make sure that the vacancies are in the places that need them. But absolutely, we need to increase the number of places that are available for those doctors.
Lady, just following on what my colleague... My Lords, we've come to the end, I'm afraid. It might be helpful if I allow, before I call the main business, to allow noble lords who wish to leave.